Hello and welcome to our Friday webinar. We are on with Dr. Tom Tully. Welcome, Dr. Tully.
Happy New Year. And it's also
Yeah,
Happy New Year, year of the fire horse or the horse, right?
it is
The
like an on
Chinese
fire
Lunar New
horse.
Year.
Yeah,
They
yeah.
had it was on the same day as Mardi Gras. How about that?
Wow. Okay.
Who
So
knew?
some and it's your first webinar with us in 2026, right? I think so. It's our first Ask the Vet of 2026 today.
Yes, it is. It is. That's what I said. Happy New Year. And so it's almost like, well, we right on the Chinese New Year,
That's
the
right.
Lunar
That's
New
right.
Year.
Coming off of Mardi Gras and all that.
Yeah,
I guess so.
that's right.
Well, if
It's
you're
all of the year, the people that are horses, born in those years, so it's their year.
that's right. I wonder how that translates to our birds. Like if you're what bird embodies the year of the horse?
I don't know. I
Sloan.
don't know. I don't think the bird is in there, but chicken maybe. I think of chicken is maybe.
Oh my goodness. Okay, so now I'm gonna ask everyone to, if you're just joining us, just if you can tell us where you're logging in from, and also, yeah, we love the weather reports and all over to see where everyone's coming in from, what weather they're dealing with, and they're yeah. So let us know where you are joining us, and let's see. Yeah, if you have a question, use the Q&A button and not the chat feature. So yeah. So you have warm weather. I'm just it's in California. It's a little chilly
Yeah,
there.
well, I mean, yeah, it was 86 yesterday.
Wow.
Yeah,
Okay.
yeah.
That's perfect. That's
But as
awesome.
I said, you know, welcome, tomorrow evening it's going to be 33, so it's going to,
You better
precipitate
get out.
drop.
You
Yeah.
better go outside
But
today while you can.
But spring's on its way. I can tell you. It's coming creeping north. So there you go.
Oh man. Okay. Okay. I guess we'll start with our okay, we have a start off question for you.
Okay.
Okay, so they want to know how common is hyperplasticity otitis in parrots? Can I give my pet parrot I'm gonna okay, Gercetin, Guercetin to
It's
help.
quercetin.
Quercetin, thank you.
Mm-hmm.
They saw in the paper that up to 200 milligrams, it helps chicken modulates oxidative stress markers and gut microbiota. I'm gonna kill every word. That's right.
Biota.
Um,
Yeah. But you're doing
uh,
good. You're doing good.
so this is
Modulates oxidative stress markers and gut microbiota. So,
thank you. And it's a green sheet conure who's they've had for 11 years. He's a rescue, so they don't know his exact age, but relatively in good health, playful. And since last December, he had one incident of sinusitis. With medication, he was better within a month, and two incidents of some sort of ear infection, which only affected his left ear. And he has swelling around his ear opening and clear discharge. The left ear hole is significantly smaller than the right, the one that's the good ear. And the vet's diagnosis is hyperplasia and
And
said that
hyperplasia. Mm-hmm.
plasia and sorry, hyperplasia and said he's had a lot of cases, but they can't find any related information about hyperplasia in birds. So we're hoping that you can understand more. So he's been on the antibiotics, anti-inflammatory medication for 6 weeks, and the swelling is not getting worse, but the healing seems really slow. And this seems to be the only discomfort he's had. So everything else he's doing fine.
Oh, well, that's good.
Yeah. And he doesn't like the medicine and he's becoming traumatized by the medicine. So yeah.
Mm-hmm.
So what are your thoughts? And yeah.
Well, I think this is a fantastic question because many times because bird ears are relatively hidden and they have a streamlined head. The bird's ears aren't sticking out like this, and so that's a good in a way, because there's just not, chickens, turkeys can have earlobes, believe it or not, and as such, anatomically, especially large male birds, but along with the comb and the wattle. But the bird's ears are, and it's kind of external acoustic meatus, if you will. That's what the external ear canal. So you have the opening on your ears. Well, if you just kind of somebody went and whoop took off your pinna, your your ear, then you would have that's kind of what the bird doesn't have anything there. And that's advantageous because dogs, where the ear kind of goes over the ear canal, it creates an environment that's one of the main issues that you have with dogs. If anybody's had dogs, is ear infections. And you know, birds, the ear canal kind of goes out, and then and it drains, and it doesn't have anything covering it but feathers that are somewhat structurally different than those that are surrounding. If you look at the round where the ear is on the bird's uh, uh, skull, you can see.
Oh, we're doing a drawing. Nice.
Yeah, well, not a drawing, but
Oh, yeah. Okay.
we have
Better.
a
Even
list,
better.
and so you have the bird here, and so if you have right around this area, you have the eye. I guess you can see that,
Hmm.
and it's going to be behind the eye, and you see how big that orbit is, and then it'll be a little bit lower. So right in this area, right here. And if you look, you'll have in most birds, you'll have different structure of feathers, and that is to aid in the bird's hearing, but you can also, that's where the bird's ear canal is. And you lift those feathers and you can see it. Sometimes there's a little flap over the ear canal, but that's kind of mobile. We really often don't have any problems. I'll set little Ray down. Uh, we don't have any, often we don't have many problems with it. And the question was correct. Uh, just don't have that. But what happens is that when you do have a problem with external ear canal, it is it can be difficult to get a handle on and frustrating. So I feel your pain. I really do. Because the veterinarian is for me, uh, I would be very uh, really I would not be happy with the results because I just know that it's a very difficult treatment to condition to resolve. So I want to make that kind of you're not doing it's this is not unusual, and it'll happen to a lot of smaller birds where you get ear infections. So this is what we're basically talking about, an ear infection. And it's the external ear infection, not the internal, past the eardrum. And so we're talking lovebirds. You have a green cheek conure here. Often we see it in the birds that weigh between 150 and 30 grams. It just seems to have this. And so when you're talking about now, you said it was a hyperplasticity otitis. Really, what that means is a fancy word for the the tissue in the ear is kind of growing. Okay, it's swelling, but it's through this inflammation. It's being stimulated to grow, and because of the inflammation and the irritation. So it's just like it's hyperplasticity. It's plastic. It can mold, but it's not like so it just grows. And it kind of extends because it's getting irritated, kind of like a callus on a hand
Hmm.
or a foot, where you keep working it, and the tissue just kind of gets thicker. And that's and it doesn't take much of the tissue to get thicker on an external ear canal. So I kind of want to explain this because it makes it difficult to treat on a small bird and to try and what you're trying to go down is a hole that's getting plugged up, you see. And then that's where you have the bacteria and things like, and the inflammation that's occurring. So that's what makes it difficult. So what you're looking at here is that your veterinarian seems to be on top of it. Um, as it relates the antibiotics and one of the things that you look at here is that you want to have it on the appropriate antibiotics and also you look at the appropriate um, means of treatment. And I'm saying this because you not that well this will do it,
Hmm.
but it has to be done to see if it can get some effect. Also, and so what I'm talking about is just not trying to get it orally in it so that the drug has to go all through the body and then up through the head into this thick skin area. You may have to, look at possibly even treating through some injection or something in that within the ear. And I'm just kind of, I don't know what the case, but I'm just trying to say you may have to go both in the ear and treat and also orally, treat topically and orally. And so those are the two things that you're looking at. And then also if the skin gets too thick and kind of closes and occludes that canal, you may have to have surgery to look and try to remove some of that tissue to actually be effective in treating if it totally occludes because it would be difficult. But each case is different and how it presents and what's best for that patient has to be determined, but I'm just kind of giving you an overview of different cases that I'm familiar with over the years. All I can tell you is that it's a challenging case presentation, and I'm not surprised on this. So um, you have to, even if you get started early, sometimes it's aggressive. The main thing, like I have mentioned before in some of the webinars, is that when you are actually treating, when you see something like this, you know it's going to be a challenge. The one thing that is, you can try to get ahead of the curve in and get a culture to try to identify specifically what bacteria or organisms are involved there so that you can get the most effective treatment early in the
Hmm.
game.
Hmm.
And it's one thing to consider if you have something like this and the veterinarian says, well, we need a culture and sensitivity. Unfortunately, they're not cheap. But it does provide the ability to identify exactly what you have there and what it's going to be most sensitive to and what's going to be the most effective treatment. So that's that. Also, you mentioned about this uh, Quercetin. Uh, uh, I haven't seen anything as far as um, any evidence that it works one way or the other. I was somewhat unfamiliar. I found, it's an antioxidant. It's, supposed to be a super antioxidant. And as you mentioned, it helps chicken modulate oxidative stress markers. Uh, the one thing that, you're looking at this and gut microbiota, I'm fully in favor of the yin and the yang because I
Hmm.
think that the my patients have to have uh, everything in the right order
Hmm.
and functioning properly, and that's why I look at the total patient to to help with the immune system to recover from whatever they present with. And because I know that the immune system in us and in birds that is 99% of what's going to be effective in overcoming the whatever the condition is, because that 1% is very important.
Mm.
That may be the antibiotic, that may be the antiviral drug, that may be whatever, but if there's not anything to back that up, then it's just not going to be effective. And we've talked about that before. So this may be helpful, but I don't think what we're looking at for the big picture, but I don't think what we're looking at is the targeted aspect for this ear issue, and it has to be somewhat of a targeted, known, specific treatment protocol with knowing what you're treating at this time, and then also trying to address that tissue that's swelling, that
Mm.
hyperplastic tissue that's occluding that canal, that's making it more difficult for it to treat and creating an environment that is more favorable to the organism. So we touched a lot of bases there,
Yeah.
even brought little Ray down, but I hope that kind of helped explain it.
Okay. Um,
Yeah.
I thought that was thorough. Question about blood work. So, okay, no, not a question. Okay, so the Senegal parrot is 20 years old. Blood work is great. So he picked all feathers on his abdomen, and he has watery droppings for almost a year. Vet thinks it's liver and has him on colchicine and milk, thistle extract. Does this
Mhm.
make sense that it's a liver with good blood work? Is it possible to the liver to regenerate? So,
Well, uh, it's we have a 20-year-old Senegal parrot,
he's
and,
picked his feathers on his abdomen.
and he's picking feathers on his abdomen. Um, and he has watery
Ooh,
droppings.
yeah.
And is there anything else?
The vet thinks it's his liver, and so he has them on milk thistle extract and colchicine.
Yeah.
Yeah.
Um,
Does it make sense? That's what they, yeah.
well,
Oh, excessive
again,
drinking
when
too.
you're looking at this, if a veterinarian is seeing birds, it's great that doing that. Um, and basing it, they are he is basing that treatment um, on what they feel is best for what they have seen and the tests that have been have been taken, what they've recommended and what's been able to be performed. So you have to consider all of that in there. Now,
Also, excessive drinking. Sorry.
yeah. So when you're looking at that, then you have to all of these factors, and what I can do here is I can give you different scenarios or different possibilities. And it by no means has anything to do with this case, because it's a single case, and they've had more views. So that could be the treatment that would be best for it. But you have feather picking, and so what I'm kind of missing here is that you have probably 150 to 150-gram parrot that has some feathers missing on his abdomen,
Mhm.
and that what I hear is blood work is good. Now, blood work can mean about 15 different tests, and that's one thing I always tell my students. And when they say blood work, and I go like, does that mean lead and zinc toxicity testing? Does that mean chlamydia testing for the blood DNA? Is it circovirus testing, or is it testing for And so we're looking at what was that? What was going on there?
Oh, I have some, sorry, I have some, they said the bile acid was 72 and no heavy metal issues.
Yeah, yeah. So if the bile acid is 72, um, that is somewhat concerning. It's not like it's not the where it's really critical, but it is somewhat concerning on that. So, like I said, I have a feeling from what I'm hearing here that the veterinarian is doing a good job on this case and looking it over. And I'm just trying to think that's that's the blood work that I'm saying. You can look at say, well, it looks pretty good when you're talking about a complete blood count. Is the white cells, is there inflammation? Is it showing inflammation? And so bile acid, somebody goes, well, what's bile acids? Well, that's liver function. That kind of gives you a little idea of what the liver function is on that. Uh, so it measures kind of byproducts if it's not functioning properly, just kind of in a nutshell. Uh,
Mm,
and in this case, you have droppings you have that are abnormal, and then you have feather picking or feather destructive behavior on the body. They may not even be related. And so initially you say, well, are they, don't kind of put them together. You go like, well, you have two things.
mm,
Now, what could cause those two things, and could those two things be related? See, it's a complex puzzle, Maybe those pieces fit together. Maybe that's just like you try to put them together and they just don't fit, right? And in the end, because you just don't know what the answer is. And so that's why I think your veterinarian is looking at this, has looked at all the blood work. Uh, colchicine, um, is something that you have allopurinol or colchicine, and it's interesting that uh, you know, is really kind of a gout issue. So you have to look at the uric acid level to look at that as a possibility to prevent the uric acid crystal formation. And so if your bird is drinking water and having watery droppings, well, those two go together like a horse and a carriage.
mm.
And it's called polyuria polydipsia. And I think I've talked about it. And I think I see uric acid is 4.9, and I don't think that's problematic. But this is something to consider too, and what makes it so, somewhat complicated. We're having some very good, complex questions today,
Yes,
Laura.
yes, we
Starting
are.
2026 off really good, because you're
Yeah,
bringing up some good points, and this is what is challenging for us, and I appreciate this webinar attendee with this question. So, as the Senegal is drinking water and urinating, and
yeah.
and so you look at that, that's kind of abnormal because most people, if you have birds, like, I never see my bird drink water, or I see it drink very little. How does it do it? So
Mm,
when somebody says it's drinking water, then that's probably, it's an interesting, when I hear that, it's like, wow, I never hear that, right? Just every
hmm.
once in a while, and then it's usually like it's associated. So that bird is drinking water. That's polydipsia. You can see dipsia. The medical profession didn't have to go far to figure these out. And then polyuria is excess urination. So the more water it drinks, the more it's going to urinate, right?
Yeah.
And so why does it need to drink more water? That's the question. It doesn't need to drink more water to urinate more, right?
Yeah.
It urinates more because it drinks more water. And so then you go like, well, what's the uric acid level? And see, this is what's the challenge on the cases and what kind of is the interesting part of the medical puzzle. And the challenge every day is to try to, you have these cases and it's like, what's going on here? Well, the uric acid is the nitrogen waste that birds produce and in their and it's really excreted through the kidneys, right? And so and through the process of filtration and everything like that, just so so what happens is you know that if the bird's kidneys aren't functioning or the bird is dehydrated, then that uric acid level is going to go up,
Mm.
you see. But uh, yeah, because because of the way that the uric acid is, there can be issues with the kidneys, okay, that are occurring that the uric acid is not going to go up because the kidney still can function, okay, enough, even though it's not functioning as well as it should, if you follow me. I don't know if that's easy to follow, is that they're the kidneys are somewhat, forgiving and that they'll keep going for a while and they can have not much. And people who have, uh, think about if anybody knows anybody that's been diabetic or on dialysis, and a lot of times that your kidneys, there's a lot of tissue that's not functioning, but you're still able to these people are still able to do okay. And that's what with birds here. So there can be issues with the kidney, but the bird is still being able to maintain a normal uric acid level. It's still able to keep the uric acid level down. And and I have seen an African gray drink water and and drink so much water, just drain a bowl and then chew the newspaper to get the water out of the newspaper. That's how quickly it was, and the blood work was normal. When you said, okay, what's the blood work? The uric acid levels were normal. The creatinine was normal. The things that we measure as far as this normally on a CBC was normal. What it ended up being was visceral gout. It was visceral gout, and I'm not saying that this is what this bird has, but that is that is a something to consider. And so that's where we have problems in birds also, is that they don't have a bladder. So how do you measure? How
Mm.
do you? How do you? You can't really assess the urine because it mixes with the feces and it contaminates it. So in birds, to try to get an idea on what the, kind of get more information on the kidney health, that's when we have to do a renal biopsy. And that's where we take an endoscope and go into the bird, and we take forceps and we get pieces of the kidney. Now that's easier on a 400-gram bird or a 500-gram bird or a kilo bird or 1.3 kilo hyacinth, right? But or even a duck or a chicken. But on a 150-gram, um, you know, cynical parrot, uh, I don't know. I'm just kind of guessing off the top of my head. Oh, it can be done. I mean, I've, sex lovebirds and, smaller, but with endoscope, but, and examined them. But that's what you have to do for a renal biopsy. So you have this Senegal, and you have colchicine. I think it's allopurinol. Maybe looking at thinking your veterinarian thinking of visceral gout in light of um, the uric acid levels being normal. When you have uh, excess water drinking, I'm sure they notice that in urine. And something else that causes, it's not common, but it does cause excess water and excess urination. Diabetic bird, diabetes mellitus, and that can cause birds to drink and urinate. But what you'd have is a high glucose, and you don't have that so that's not likely. And then we go to the bile acids. The bile acids are somewhat elevated, but as you said, can the liver be forgiving? Um, there's a lot of people that drink a lot of alcohol, and you can see that the liver can be forgiving. It's as forgiving in birds as it is in other in humans. It's a forgiving tissue, but and so it can recover. But what is it recovering from? It's not that bad. Is there a correlation between the drinking and the urination and the kind of the elevated, we'll call it elevated liver enzymes, and when you say milk thistle, uh, uh, you're looking at a um, kind of a supplement that
Yeah.
is a protectant. That's all. It's protecting that liver tissue. It's not treating anything. It's like it's putting a little buffer on it. So whatever's attacking it or attacking the cells, it's going to uh, kind of protect it. And so that's all that the but that could be enough. And if there's something it's continuing exposed to, that may be it. But I'm afraid that if depending, I don't know if you've had radiographs or what have you, but I think that the next step on the little bird would be um, to think about everything, and it's not getting any better. Um, would be an endoscopic exam on that little bird. Yeah, but I think you
Okay.
need to go in with yeah, he had radiograph, but radiographs, if there's uh, gout in there, or if there's any evidence of any other abnormality you can actually see the organs. I think you gotta go in with a scope. That's that's my conclusion, but I think we touched on a number of
Yeah.
things as far as renal issues and polyuria and polydipsia that we haven't, gout and how it can look normal. The blood work can look, your uric acid or the analytes we call it that you look for kidney uh, possible damage. Which is somewhat few. We're limited in birds because they don't have a bladder, but that it can be normal and they can have a serious disease going on. Yeah. So thank you so much.
Yeah.
But that's where, in the end, would go, and you have a liver protectant, and I think the colchicine or the allopurinol is, uh, try to reduce if it is visceral gout, trying to help you. So I think your veterinarian is doing a good job for you. There you go.
Okay. Question about walnuts. Is it possible walnuts could have health benefits for parrots as they do for humans?
Is walnuts as
Healthy. Do they reap the same health benefits as they do for us, or walnuts? Can we give walnuts
you
to our
know,
pets?
I think walnuts. I think one of the things is walnuts is a just like anything else. Walnuts are high in oil, and you have to think about the what the bird is ingesting versus the size and how much over time. And I have you know I think that as far as just um a kind of part of a diversified diet, I don't see any problem. But I don't think that it's like um you should I don't think the way I would look at it is that I'm giving it as part of the diet and not a major part of the diet. Um, and with doing that, that it would I wouldn't be concerned about overfeeding it, and I don't think, and then that would be my biggest concern. But and just the benefits will be coming from the everything within the diet together. And
Okay. I
did that kind of answer it?
think so. I
Yeah,
mean, walnuts could be, I mean, I guess a lot of it just moderation, right? It's too,
yeah,
is it?
exactly. And also don't let the bird decide.
It's true.
I mean, that's if you let the bird decide, next thing you know, he's going to only be eating walnuts. I mean,
It's true.
hey, it's great.
Yeah. Well, I mean, what birds can, I think, is it macaws that, well, walnuts and shell? I can't imagine any other bird.
Oh, no macadamia nuts in the shell. I
Yeah.
mean, I
Yeah.
think that's harder to crack than a walnut. But I mean, it may be there's no significant difference between a hard walnut and a hard macadamia nut. But a hyacinth can do it. Take care of it anyway.
Uh,
But I
there.
mean, I mentioned, it's hyacinth just will start eating macadamia nuts only, and you're feeding them all the right diet. The next thing you know, they have deficiencies that are
Wow.
life threatening. Yeah,
Wow.
because they're
Okay.
smart, right? I'm gonna
Yeah.
only eat what I want to eat, right?
Yeah. Yeah. Okay. So we have a question about a hen who's, so another online vet recommended antibiotics. So right now they just have Tiagard, Tiagard on hand and doxytylenol coming in the mail. The vet said that they should start her on that. They're hesitant because they're not sure what she has. She has a little labored breathing, but not wheezing. Someone thought water belly, but wonder if she's taking antibiotics. So is that going to hurt her? Another problem is getting her to drink water. She ate some shrimp and mealworms today, maybe some feed. So her comb is purplish and spots. And actually, let's see, she started with vent gleat and then had a labored breathing. So they're trying to give her a bath that seemed to stress her out more. So now they're just trying to clean her bottom with a wet washcloth.
Mm-hmm.
Do you
Hence
know
that.
what might be going on with this hen?
So start at the beginning here. Let's
Okay, there's a lot going on with hen. Okay, so he's on has some antibiotics coming in the mail. So one it's Tiagard, Tiargard, and then doxytylenol or Tilin.
yeah, doxycycline.
Okay. Oh, okay,
Yeah.
has a slash in it. Sorry. Okay. So she has a little labored breathing, but she's not wheezing. And someone thought it might be water belly. Um, and they're wondering if she has water belly, is having her taking antibiotics going to hurt her? And then the other problem is trying to get her to drink water. So she did kind of eat today and stuff, and had a little, but then had a vent gleat. I'm not sure, something with the
Yeah, and I
vent.
think that's
So they're cleaning the
just
bottom with the washcloth.
kind of soiling of the vent,
Okay.
kind of on that. Yeah, I've heard that as common term. With chickens and like soiled vent. I'm gonna go with that.
Yeah.
I
So
could be wrong, but I'm going out on a limb.
yeah.
And so uh, the uh, the one thing that I'm not sure is what uh, uh, so the birds have a labored breathing. Somebody says it could be water belly.
Mhm.
So that's just like fluid on the. I don't know if anybody sees the pit or watches the pit. That's a show, and they had a gentleman come in there and they removed all of this fluid from his stomach, okay, or his abdomen, and so that's what water belly is in birds, and we've removed. Uh, Proportional amounts of like that fluid in chickens before,
Mhm.
especially hens. And so it's their abdomen, so it's hence water belly fluid in the the abdomen. And so what causes that? It happens in we have a little parrot that we had water belly in, and we're gonna uh, have that come out in journal. But the thing is that different things can cause it. But in chickens, most of the time it's related to the reproductive tract.
Mm.
And if this is a hen, now chickens are not short day layers, but if there's enough light, they may be laying over winter. But usually you have to start getting into a little bit more light, and we're getting closer. But um, and so if you have the hen there, and this could be, um, it's not uncommon to see this. And so, well, why does reproduction in water belly affect the breathing? Because birds don't have a diaphragm and they have air sacs. And the water belly, what that does is that just compresses that that respiratory volume in the bird. So it's just like it doesn't have the airspace that it can breathe normally. So then what happens is that, excuse me, then what happens is it's labored breathing like that. And so we get here and then we're at antibiotics. But what I did not hear is that somebody looked at it and made said, "Oh, well, look at this. You've taken it to a doctor, and the doctors looked at it and said, well, the reason it's breathing bad is because it has 1 liter of fluid on its belly." Okay. Or, not. Because if you do have water belly, and I don't know where that, just, well, that's a reason that the bird could have rapid breathing or have difficulty breathing. Then what you do is you remove that 1 liter or 500 mils or what have you, fluid from the coelom, and guess what? The bird's breathing normal, you know? But then you still have the problem of what caused it. So in most cases, when you have this, when we're talking just like in a normal situation, you have maybe a reproductive tract problem, it's not an infection. So the antibiotics do not help, and you're spending money you don't need to spend. and it's just not gonna work. Now, one thing is that because the only benefit is somebody can say, well, the bird is immunocompromised, it's stressed, and so it's susceptible. Well, the one thing is that you're stressing it, again, giving it the antibiotics. On that, I just think that the good doesn't outweigh the bad in that type of situation if you don't know what's going on. And then there's another thing. There's another issue that could cause it that we see in chickens in particular, and that's the big C, cancer.
Mm.
Is a, and so you have ovarian cancer, which is not that's associated. They have a very highly functional and um, ovary and laying the eggs, and that doesn't necessarily denote that they're gonna have possibly ovarian or a number of other different cancers that can be involved there. But that is another thing that can cause this fluid buildup or water belly, as you can say, and that just the stress on that reproductive tract, if that's what it is, could be causing some of the loose stool that you're seeing on that. But this is all very easy to determine by just feeling it and kind of identifying what the situation is. You can feel it if it's like a basketball down there and you got a lot of pressure, it's likely fluid on that. You identify what the fluid looks like. Sometimes you can get cancer cells in the fluid. Sometimes you just get clear to pale yellow fluid if it's maybe reproduction issues. And the bird breathes better, and you know what you know where you are when you have the fluid in there. An ultrasound imaging really works well to try to identify if it's what exactly may be causing that issue. So that's where I would go with it, and if it's anything like you said, and if it is water belly, um, or fluid within that caudal coelomic cavity, then you're going to uh, the antibiotics aren't going to be that effective on that. But removing that fluid is going to help the bird breathe a lot better. Then you have to identify what it is. There you go.
Okay, there's our chicken question.
Yeah.
Um,
Well, you never know. We may
yeah,
get another one, and
well,
that's good because we
yeah,
see a lot of chicken.
there we go. This one is about a cockatiel. It's a 26-year-old cockatiel that's been sneezing for months despite medications. Now he's coughing and open beak breathing despite having antifungal and antibiotics and trying a heart medication as well. So the vet thinks maybe he has a tumor or enlarged organ, but doesn't think it's worth stressing him out for an x-ray since there's nothing one can do if he's had a tumor or enlarged organ. She says it's best to let him live his life until he passes. Is there anything else they can do to try to help him? So 26-year-old cockatiel sneezing for months and open beak breathing. Just yeah,
A 26-year-old cockatiel.
yeah. And the vet thinks that
Congratulations.
yeah,
No,
yeah.
I mean, congratulations. I mean, I've got a 26-year-old cockatiel. I'm gonna say we have a 29, 30-year-old cockatiel right now, one of our patients, and um, I would just want to congratulate that owner. They've done a wonderful job, and they have a right to be concerned. And it's kind of like when my grandmother, my grandmother, I think I've mentioned this before. She was 92, and she went to the physician, and she had she was going because she had a medical issue, and they said. Uh, he comes in and says, she tells him this, and he says, well, Miss Fairchild, you know how old you are, don't you? And she said, I know exactly how old I am. And I didn't come in here to tell you how old I was. I came here so you could help me or you could tell me what I need to do to get better, you know? So age isn't a disease, but I can tell you that age is associated with the increased uh, susceptibility to disease processes. And as with your cockatiel, I don't recommend anyone as they get old chalk it up to age and just not try to do what you can, what to overcome it. So I applaud you for that. The one that what you're looking at here is what you have to consider is that any diagnostic tests that would be helpful uh, to try to identify what's going on is what you have to determine how risky it is to for that your bird to survive that test. And I think that's what your veterinarian is considering. How and it's just like when I tell people, well, you have an emergency case, the bird's been traumatized or it's been, um, uh, it's not doing well, and you rush it to the emergency room, and and it's just barely standing there, and so the bird doesn't make it. And you say, well, what did you do, Doc? What did you do? Well, we were able to give it a couple of injections and a little bit of fluids, but we set it in the incubator to maybe pain medication, anti-inflammatory. But quickly we were prepared, and then we set it in um, the critical care unit for to heat and oxygen. You didn't do anything more, because that's what, why didn't you do this or why didn't you do that? Well, if we would have done more, guess what would have happened? It would have died sooner.
Yeah.
You have to know what that delicate balance is between life and, you know, pushing it over the edge. And so it doesn't do any good for the animal to come in or the bird to come in and say, "Oh, we got to get this test. We got to run this test. Let's get this blood. Let's do this. Let's hold the bird or stress it out in a time of extreme duress." And we get all the samples, and the bird dies. You know. So it's like, what can we do and what should we do so we have the best chance of our patient surviving the next day or continued?
Mhm.
And you have to consider age, you have to consider the risk and of what you can do to try to get the information that's going to be helpful to try to identify what this issue is and how bad it is one thing that you can do is you can get some blood work. That's you can get a CBC just to see if there's inflammation going on that. And so that's one of and possibly of course, and think about with the size of the little bird, um, how much, if you're looking at sinuses, upper respiratory sinuses, there's some things that you can look at, just observationally, the choana, and possibly getting a maybe a next generation sequencing culture if there it appears to be some inflammation going on that and that would kind of kind of give you an idea of culturing through DNA, like fungal organisms or any type of bacteria that you can kind of cast a wide net for that, and then possibly if you do find something and it corresponds with the blood work, those are just two simple tests
Mhm.
that would be helpful to say, well, it is possibly an infection or it's not an infection on that.
So it says that they did swab the Coena and poop and it showed nothing, no parasites. So
Yeah, but we're talking bacteria,
yes.
and then also I would say a CBC would definitely be in order, and I would take that over a chemistry panel in the first, with the bird doing well at 26 years old, considering it's 26 years old, and just with the to look at the PCV, look at the white blood cell count and the differential on that. That's what I would be looking and weighing 70 grams. So you could collect 40 mil, point, 4/10 of a mil of blood or half a mil for a CBC in differential. You can take that and then do the culture. Um, and I would like a my dog culture and then see on that. And I think that would be a very what I would consider, um, you know, the least amount of stress to get the most amount of information. And it's 70 grams, and that's the one thing that you're looking at a 26-year-old bird. What happens when you get older? Do you get muscles and big like the Arnold Schwarzenegger of 1977? No. You look like Arnold Schwarzenegger of 2026, right? And so your muscles shrink, and so that's just this atrophy. And so the question is it 70 grams? And I think most people out there will say, well, a 70-gram cockatiel is a small cockatiel. You wouldn't want to think that the 70-gram cockatiel was once a 95-gram cockatiel, right?
Mm.
So that's another thing to consider, and I think your veterinarian's considering that, and that's what is always nice to see that you have veterinarians that are considering the patient's well-being, and that's good to know. But those are just some thoughts on that cockatiel, and thank you. That's great, and again, congratulations on 26 years. Woohoo!
Yeah. Okay. They just want to know, is there anything, if there is inflammation, can they give them anything for it, for the cocktail?
Yeah, and the one thing is that there are some medications that they can give for the inflammation and possibly for the sneezing. We have used some medication for birds for sneezing. Meropitant is something that we have used for drops for sneezing, um,
Okay.
and that seems to help. It helps with rats and sneezing too. So, yeah.
So, I had just a real quick follow-up because I know we're out of time, but someone asked, is a scope risky? Are there, as opposed to like an X-ray, like having your bird go undergo a scope? Are
Is
there
it
risky? Is there?
is it risky because well you can take radiographs with a sedated bird, and so it's not unconscious, and so the scope is riskier um, because you have to anesthetize the bird and under general anesthesia. And you want to make sure that you have somebody who is experienced with the scope and who's confident in using a scope, especially on a 150-gram bird. But like I said, I mean, the people who are experienced using endoscopes um, have no trouble scoping a 40-gram bird. So your bird is like three times bigger than a 40-gram lovebird, right? So um, that's it is. You have general anesthesia. You're going into the side of the bird, so as I always say, with general anesthesia, there's no such thing as a minor procedure, whether it's for me, you, or the bird. If we go under general anesthesia, it's always a major deal. Uh, but yeah, and so that's the difference between radiographs. If you do radiographs, you could do it sedated, and they could put it in a box or what have you. And we do different things to try to reduce the risk of some of our riskier patients on that. But I think that yeah,
Okay.
but I
Okay.
think that the scope would if you talk to somebody that would is able to do it, they could probably assess the case and tell you how um, how much they would recommend it or not.
Okay. Okay.
Yeah,
They said thanks for congratulating them on their cockatiel's age. That's true. It's a good
yeah,
cockatiel age.
oh yeah.
So, um, well, we're out of time, but thank you, Dr. Tully, for your insight. Once again, welcome back to our webinars 2026 with you. First one
I
out of the
mean,
way.
we they
So,
they hit it out of the park today,
yeah,
man. They
it's
they
some
have
complicated ones.
they made me
Yeah,
dancing today. I
that's
mean, that
right.
was I mean,
And you're fighting
I
a
had to
cold, so thank you for coming under the weather and answering
Well, I
these.
mean,
Yeah, appreciate it.
that's why this medium is nice when somebody has a little cold. So,
Yeah.
but no, they did great, and they even got little Ray out of down here, and so
Oh, your parrot skill. Yeah,
very
bring Ray out.
complex, and that's the one thing I don't know how many of these we've done, but the attendees come in and with some great information, and
Yeah.
so I appreciate it, and a great way to start 2026.
Yes, yes, for sure. And if we didn't get to your question, we'll try to answer it another time or via email. So, and then next Friday, we're going to be on with Lisa Bono, and she's going to be doing a look at bird shows. So, an episode of her for parrots past and present, best in show, a look at bird shows. So, join us next Friday to find out what that's all about. And
Ah,
there we go.
until next time, Laura.
Yes, that was
All right.
all right. You take care, rest
Thank
up, get
you.
over your cold, and we'll
Yes,
see you next
yes,
time.
yes. All right.
All right,
And
guys.
thank you, everybody.
Thank
Great.
you.
Uh-huh.
All the best to you and your flock. Until next time, everyone, have a great weekend. Stay safe. Bye.
Bye.